How to drain ear fluid. Fluid in the ear is one of the main effects of middle ear infections or acute otitis media (OM). Ear infections result when fluid, usually pus, is in the inner ear and causes pain, redness of the eardrum, and potentially also a fever. Fluid in the ear, however, can also persist after an infection is dissipated. Moreover, treatment of the underlying cause of the problem is the most important step. Diagnosing the problem. 1. Take note of visible symptoms related to the ear. The most common symptoms of OM and OME include ear pain or ear tugging, if the child can't yet verbalize the pain, fussiness, fever, and even vomiting. In addition, a child may eat or have trouble sleeping normally because lying down, chewing, and sucking can alter the pressure in the ear and cause pain. 2. Keep track of symptoms related to the common cold. Ear infections are considered secondary infections that follow the common cold or the primary infection. You should expect to see a few days of nasal discharge or congestion, cough, sore throat, and a low fever, all typical symptoms that accompany colds. 3. Look for signs of hearing problems. OM and OME can block sounds, which can lead to hearing issues. Signs that proper hearing may be impacted include the need to turn up the TV or radio to a louder volume, talking in an unusually loud voice, general inattentiveness. Draining ear fluid. 1. Use a nasal steroid spray. These are available by prescription and can help open up the eustachian tube. It works by reducing inflammation in the nose, which in turn helps the eustachian tube to clear out. Note, however, that it takes a few days for the steroid to build up to its full effect. This means that you'll not experience immediate relief. 2. Use decongestants. Using an over-the-counter decongestant or medication can unblock your ear to help drain the fluid. You can get them in the form of nasal sprays or as oral medication, and they can be purchased at most pharmacies. Be sure to follow any instructions on the label. 3. Take antihistamine tablets. Some people find antihistamines useful, particularly in longer-lasting occurrences of sinus infections, because they can help ease nasal congestion. 4. Do a steam treatment. A home steam treatment can help open the eustachian tube and release the fluid. Basically, all you need is a warm towel and a bowl of hot water. 5. Note that all of these methods have not been supported with reliable scientific data. Most studies suggest that these methods have little to no effect. Ultimately, in most cases, the fluid that collects in the inner ear almost always fixes itself, unless it's the result of a chronic condition or persistent ear infections. Treating ear infections and persistent fluid. 1. Be aware that there's no single best approach for treatment. When deciding on a course of treatment, your doctor will consider a number of factors, including age, the type, severity, and duration of the infection, the frequency of ear infections in the medical history, and whether the infection has resulted in hearing impairment. 2. Follow the wait-and-see approach. Most of the time, the human immune system can fight off and heal ear infections with a bit of time, usually 2 to 3 days. The fact that most ear infections can actually clear up on their own has led a number of physician associations to support the wait-and-see approach, which essentially means administering pain relief but not treating the infection with antibiotics.